Thank you so much. And thank you again for the opportunity to be here and to share a bit about the research and the project that we've been working on. I'm going to share my screen and begin the presentation at this time. So in the share screen, it's not actually giving me the opportunity to share the oh, there it is. Okay, I found it. Sorry about that. Let's go from here.
I'm sorry, we can't able to hear the voice. Audio, we cannot able to hear the audio.
You can't?
Yes, we don't hear the voice.
Okay. All right. Then each time I'll probably have to stop and just silence that and provide that voiceover at this time. I don't know why. Hold on.
Here's the outline of the topics that we'll cover. The care and delivery of the role of the nurse.
We can hear now.
Okay, thank you. The overview of clinical management of atopic dermatitis, how to promote well-being in atopic dermatitis, important patient education tools, and e-health strategies for management. First, the overview of AD. What is atopic dermatitis, or AD? It's a chronic inflammatory skin disease that is often characterized by scaling lesions that are very itchy and red and have intense itch. That's what this is the most common complaint made by patients. The disease pathophysiology is absolutely complex. It's genetic, environmental, immunological factors. There are many different things that come into play when talking about atopic dermatitis and what the underlying factors may be. The fact is that we now understand that many patients actually have defects in their epidermal barrier, in their skin barrier, which contribute to the overall dehydration, and that often is associated with gene mutations or polymorphisms in the filaggrin, as well as the altered lipid metabolism of patients. Most people are surprised to learn that AD is very common. In fact, it affects greater than 20 to 30% of all children across the globe. It usually appears during early childhood or infancy, and again, significant prevalence. Most children will have spontaneous remission, so they'll have times that they'll have flares and then it will resolve. However, 30% of cases actually persist into adulthood. So in adulthood, about 7 to 10% of adults currently live with AD, and adult onset of AD is actually very well recognized. But when we do a greater history of those patients, we find that many of them actually have had atopic dermatitis since childhood. It's also important to note that about 80% of those patients have some type of atopic background, whether that's extrinsic or allergic atopic dermatitis. And then 20% have intrinsic or non-allergic AD. Now, the allergic march is a phenomenon that definitely many children go through. And it is the atopic march or allergic march that is that natural progression of allergic disease from infancy to childhood. Oftentimes it starts with AD or eczema and begins with that skin irritation and then moves into food allergies and then oftentimes environmental allergies. And then that child or young adult may progress even into asthma. And so this, again, is a very well documented phenomenon that's understood and impacts a significant amount of children and adults. We also know that eczema or AD has many comorbidities, including cardiovascular disease, autoimmune disease, and depression, anxiety, self-esteem issues. One of the key aspects of the role of nursing in AD is assessing these quality of life issues, understanding that there can be psychological upset, sleep disturbance, and skin irritation and itch or pruritus. And so, especially when we're talking about sleep disturbance, it's oftentimes hard to truly understand the significant impact on the quality of life that AD may have. We know that the disease is cyclical and that there are these times of periodic exacerbation or flare. So, that chronic relapsing pattern for many patients, the ongoing treatment and trying different things that we often hear in the patient journey, people are just cycling and cycling and extremely frustrated because they cannot find the appropriate topical treatment, oftentimes, to control their symptoms. It's also important for that AD nurse to identify triggers that may be causing or contributing to the flares. And the treatment aims are always to alleviate the disease symptoms and reduce the frequency and severity of those flares, and really overall to enhance the quality. So, the unique value of the nurse in providing care in the team is what this publication was all about. And we know that atopic dermatitis is managed differently in different settings, whether that be primary care, day clinics, secondary and tertiary care. And so it's about 10% of patients that actually have severe disease that end up seeing a specialist, being managed by a specialist. And again, 80 to 90% have that milder disease that oftentimes is setting. Now, hospital admission is quite uncommon in eczema or AD, but it can be provided for those patients that have severe or recalcitrant disease. Some of the benefits of inpatient care is having that more structured treatment plan and providing that extensive education that's oftentimes needed. We can help optimize topical therapy in the outpatient setting and with follow-up. And sometimes that actually reduces the need for overall systemic therapy. The truth is, nurses in all settings play a vital role in caring for patients with AD. That nurse involvement in providing and supporting clinical care support with the dermatologist or the allergologist is very important. It allows for greater time to provide that more comprehensive management approach. The nurse specialist or patient consultation oftentimes addresses a range of different aspects, including disease scoring, education, emotional support, and just providing that very pragmatic, practical advice for patients. Now, in the ideal setting, AD care would be delivered by a multidisciplinary team. And here we can see the composition of that team. It may vary depending on the setting, the institution, or even the country that one resides. But what we found is that those multidisciplinary initiatives and interventions really do result in more positive effect and outcomes in AD. The nurse has a vital leadership role in this multidisciplinary approach. As the primary patient and family contact, they provide that continuity of care. And we know that patients trust nurses even more than oftentimes the physician. So it's vitally important the role that nurses play in eczema management. That spectrum of patient engagement, again, we know that there are those very highly motivated, informed, educated patients, but we also know that the other extreme are those that feel completely lacking empowerment and rely solely on their healthcare team. A lot of the work that we do at Global Allergy and Airways Patient Platform is to help patients become that more motivated, informed, empowered patient, but recognizing where patients are on that spectrum and providing the appropriate level of engagement and support. Now, the truth is, attitudes change throughout this spectrum and throughout the process. Once we know what the most appropriate, realistic information is for that patient, then we can ensure better efficacy, safety, and suitability or tailoring of those proposed treatments. And it oftentimes is through a shared decision-making process the risk and benefit of each treatment option. Again, at Global Allergy and Airways Patient Platform, we've developed shared decision-making tools in conditions like allergy, asthma, and atopic dermatitis. And the nurse can actually play a vital role in guiding the patients through this decision-making process. It's that correct management of medication and considering the frequency, the adaptation of the routine and how willing the patient is to actually go through with that daily routine that will help to get the right treatment to the right patient at the right time with the fewest side effects or. Now, again, in the overview of clinical management, how do we get patients to go about being people rather in the overall diagnosis and treatment of AD? We know diagnosis is based on many different things, including family history, personal history, the clinical features that present. There are major diagnostic criteria that have been established and ways to go about diagnosing AD effectively. And here are some of those that are listed. We also need to consider the supportive diagnostic elements and consider how long the disease has been going on. What is that pattern of relapse and flare versus remission? How early did the symptoms begin? And then what are some of those potential triggers? It may be food that is contributing to the exacerbations or flare of AD. It could be the environmental factors, and certainly in some cases, even occupational or job related. So the treatment recommendations are based on three things. First of all, they're based on disease severity and the therapeutic response at each of those severity levels. Secondly, again, when we're talking about that assessment severity, we're three different levels: mild, moderate, or severe. And then thirdly, we need to understand and anticipate individuals' treatment needs. So perhaps they just say, honestly, there's no way we can apply an ointment 2 or 3 times a day. Or perhaps it is, there's no way we can avoid this particular activity or this trigger in the patient. So first, let's start with the assessment of severity. Again, it should be assessed at presentation, but also each and every time throughout the disease course. And oftentimes, unfortunately, healthcare providers lack knowledge specifically about skin of color. AD presents differently in skin of color. And so as a nurse, it's important to understand that there are a wide range of scoring tools and to understand that cyclical nature of severity, from exacerbation, disease flare, remission, and then starting all over once again. Scoring tools that are most commonly used by the AD nurse. First, it is that SCORAD tool that scores atopic dermatitis index. And again, it is the clinical and patient-oriented versions that we most commonly recommend and see nurses using most readily. There's also the eczema area and severity index, and this demonstrates and has the patient recognize the extent and severity of skin disease only. There are many different patient-reported outcomes when it comes to AD and different tools. Most of these assess quality of life and can oftentimes be disease-specific, but not always. So there are things like the patient-oriented eczema measure and the dermatology life quality index as recommended tools. But the truth is, these tools may not always be employed in the clinical setting. Although we know that the use is on the rise and the increase, nurses can be critical to help facilitate objective assessment and really to inform the doctor about disease management and the patient decisions about treatment. So discussing these measures with patients and providing that context really does aim to get and achieve better. So again, some of the basic principles for the treatment of AD: identification of triggers and factors, skin rehydration to repair and restore that impaired skin barrier, reducing the itch pruritus, reducing the inflammation, and especially during flares. Oftentimes that requires both topical and or. So in this article, nurse specialists, certainly we reinforce time and time again, are a crucial resource for patient education and support throughout all the treatment. Um, and again, understanding environmental irritants, known allergies, how these may aggravate the skin and actually promote disease flares. Sometimes it's as simple as the fabric, ensuring that patients aren't wearing things like acrylic or wool that may be irritating their skin. Other times it is those household chemicals. Perhaps they're using bleach or other solvents. Or maybe it's fragrances that are causing the skin irritation. So it's not always allergies, it can also be irritants. And we always recommend the use of daily emollients to reduce moisture loss, and that is the mainstay of treatment. We know that it reduces the itching. It has a steroid-sparing effect, whether that be topical steroids or on occasion oral steroids. And it can definitely be, OTC products can be as effective as some of the specialist prescription forms. So it may be lotions, potions, and creams, we often say in managing AD, but finding the right combination of products that helps to reduce that inflammation and the ongoing itch. So it's important to assess the level of dryness and the patient preference when thinking about adherence to these emollient uses. And again, we often say it's important to apply directly to the skin after bathing, and then maybe throughout the day. Now, wet wrap therapy is a therapy that is often used in coordination with standard skincare and topical therapies. It involves using that emollient and then covering with a layer of wet bandage or clothing, and again, sleeping in that on an ongoing basis. And especially this is very useful in children because it keeps them from scratching and itching throughout the night. So we know that there are some drawbacks to wet wrap therapy, including poor adherence, but the nurse support and understanding and having people accept and adopt that behavior is vitally important. So engaging both the parent and child, providing perhaps rewards or incentives for people to use wet wrap therapy may be yet another way to ensure better outcomes. Now, there are different medical therapies for atopic dermatitis, and it's important for the nurse to be aware. First, the topical agents, again, the TCS, topical calcineurin inhibitors, and those are often used for mild to medium or moderate potency, but they can be moved to a high potency for PRN. Phototherapy, again, has been very effective with some patients, but it can be time consuming and also costly, is not always covered. And then more recent systemic agents that have come onto the market. Again, these are topical, systemic agents that are monoclonal antibodies, and we'll talk more about them in just a moment. Topical steroids. Now, this is the mainstay. It's the most common that is prescribed. And again, you can see here, it's classified by strength. There are many different options. You apply after bath along with a moisturizer, and many patients use these for years on end. Unfortunately, a segment of patients actually have topical steroid withdrawal, and that can be due to inappropriate overuse or inappropriate use over time. It could be to poor education or awareness about the side effects of TSW, and it can occur even days to weeks after those topical steroids are discontinued. So it's important as a nurse to recognize that burning, stinging, bright red skin that comes with TSW and provide the supportive care on how you should address that as a patient. Oral corticosteroids, again, inexpensive, reduce inflammation, but the truth is over the course of time, there are short-term negative side effects and long-term side effects that are evident here in this particular slide. So we really only recommend fewer than 2 OCS prescriptions in a 12-month time frame for any condition. And so this steroid stewardship effort is an important that we promote at GAP, and we would encourage you as nurses to also consider. A huge aspect of managing AD is promoting the overall well-being and the populations. Certainly understanding that there are comorbidities and that these comorbidities oftentimes can definitely be addressed through those conversations with the AD. And of course, smoking, general health for AD patients, we always encourage people to stop smoking, but also to reduce the use of alcohol and have regular exercise, weight. Psychological health. Now, this is very common, especially in moderate to severe AD. We often hear sleep disturbance and how that impacts mood, anxiety, self-esteem, intimacy within personal relationships. If your skin is sensitive, if you aren't sleeping well, the last thing you're going to want is for someone to touch you intimately. There are also financial concerns, and at times when AD is severe, it can impact work productivity. So finally, again, nursing focus. We know that nurses are well placed to provide that counseling to patients and parents. They actively listen, they use motivational interviewing, they use their clinical judgment to really help provide that true multi-care team approach and ensure that it is made when necessary. In the last few moments, we want to talk about patient education and how that leads to role of the nurse. Again, you provide that education based on the disease background, standards of care, and detailing the risk and benefits of all the recommended treatments. It are these type of therapeutic patient education programs that nurses play such a primary role in understanding the evidence-based approaches and engaging. So sometimes this can be in a group education setting, and some of the most successful approaches have been eczema schools that are multidisciplinary. Individualized education can also be provided in an outpatient or a day clinic setting, and that can be where you provide that ongoing training about skincare, topical therapies. It's important to have trusted information sources and to ensure that your patients are benefiting from those trusted information sources. And again, you do those best. Now, in recent days, of course, with the pandemic, the introduction of e-health strategies in atopic dermatitis has taken center stage. So again, it's important to know that we can use information and communication technologies to provide that additional avenue for supportive AD care, whether that's scheduling appointments, prescription reminders, online medical consultation, doing that shared decision making. There are many different types of telehealth platforms, mobile apps, online tools and resources. And the ultimate aim of all of these is to increase adherence and to reduce of disease. Many people have never seen an eczema or AD action plan. This is a wonderful example, but it provides that checklist of instruction to support self-management. And it allows the family to feel empowered and engaged in order to manage their disease more effectively. And you can find this eczema action plan at our GAP website and download it to use. So again, the take-home messages: nurse specialists play a central role in not only the assessment, but also the management of AD patients and the family dynamic. Ideally, we can position the nurse in a strong long-term relationship with the patient and family, and that engagement promotes trust and enhances self-management and overall. Nurses are unique clinicians, and they are more than just quote unquote nice helpers. They care for the whole patient. They are the most trusted messenger in the healthcare team oftentimes, and they help people live their very best life. So you take that clinical information and you transform it into life-altering empowerment for patients. And we at the Global Allergy and Airways Patient Platform appreciate each of you and the role that you play.